Hello again everybody, it's Friday, so that means it's Friday ParaVlog time. Now I'm going to be quick because I'm filming to my phone this week because I can't show any past captures or anything like that on the computer because it's busy at the moment producing stuff. So I just thought I'd share with you what we're getting up to this weekend instead. We're going to be going to the Leeds Asylum and investigating that for paranormal activity. It's going to be myself, Laura, Nikki and some of her team from Paranormal Eye, and we can't wait to get there and see what ghostly finds we can find within that building. Now, the asylum itself, it's mostly been renovated, or part of it has been renovated into a museum, which is now called the Thackeray Museum, I believe, if that's how you pronounce it. I'm not sure if that's how they say it. Thackeray, I think. So that contains most of the equipment that this hospital would have housed back in the day and the paraphernalia. But we're hoping to access all of the older parts of the building because it looks absolutely humongous and it will be smouldering with history. I mean, these asylums, they were put up all across Britain back in the 1800s during the Victorian period. And they were built for the mentally impaired people in that time. People who were considered as not quite fitting into society because they were a little bit backwards, or they were a bit depressed, or they couldn't quite cope with certain things, or they weren't seen in a certain way. So what happened is their families or their loved ones or even the community or their doctors would put them into these homes saying that they would be better within a couple of weeks, or say, you know, they'd go there for a couple of weeks rest. And a lot of the times these patients would never see the light of day again. Some of them went there and they would stay months at a time, some for years at a time, some for their whole lifetime. A lot of patients would have died there. A lot of patients would have died during some of the harsh procedures the doctors performed on them back in that day, because back in that day, really, these patients were the guinea pigs of the scientific world back at that time, because psychology and science itself wasn't as advanced as what it is nowadays. And a lot of the things these patients were admitted for nowadays are treatable outside, and back then they would have been treatable outside of hospital as well. But I mean, just to give you an idea of some of the horrible things that went on there, some of the procedures, there was the main one which was called ECT, and that stands for electroconvulsive therapy. And they would have members of staff holding their feet, their knees and their shoulders while the doctor then performed the procedure on their brain with these electronic shocking devices. And that was said to shock the brain and kind of reboot it in a way. And that was performed on a heck of a lot of the patients that went there. Another procedure, which is a little bit worse, was a lobotomy. And a lobotomy is where they would drill into the skull and they would burn away certain parts of the brain to try and cure the patient from their mental illness. So you can imagine how patients would have turned out after having something like that done. It's absolutely awful. Another thing was insulin injections. They would have given them very high doses of insulin to eliminate all the blood sugar from their body, which would then induce a coma. And that was then said to relax the brain and then help try and cure these patients from their illnesses. Yeah, it's bad. But I mean, another thing which was a very common thing that went on within these homes were patients were that vulnerable that a lot of the staff abused them. A lot of the staff would get angry and hit them and just treat them in ways that they should never have been treated. So the pain and suffering and things that happened within these asylums just would have been really, really bad at times. So yeah, when we go there at the weekend, I'm just hoping that we get a glimpse into the kind of lives these people experienced, whether it be the patients, the workers, or what really. But I'm sure there's going to be loads there. If there isn't, I'll be very surprised. So yeah, that's it for today. Until the next, bye for now.